Okay, let's talk about something that can make any parent's heart stop for a second. Your child comes to you and says, "My chest hurts." And your mind just goes to the worst case scenario, right? But how often is that fear actually justified? Well, in this explainer, we're going to break it all down and really separate the facts from the fear. So here is how we're going to tackle this. First, we'll start with a story that feels a little too real for comfort. Then we'll hit you with a major reality check from the data. After that, we'll decode the things that are usually to blame, and then, super important, we'll cover the red flags you absolutely need to know. We'll peek behind the curtain at what a doctor is looking for, and we'll finish up by solving the mystery of that opening story. All right, let's just jump right into the deep end. We're going to start with a scenario that gets right to the heart of all this anxiety. Yep, there it is. That's the one. The question that flashes through your mind before anything else. It's this deep, protective instinct, and it's what sends so many families rushing to the emergency room, just desperate for answers and, honestly, for some reassurance. Now, let's get specific. Picture this case, which is drawn from our source material. A little 4-year-old girl says she has chest pain. That's scary enough. But then you layer on the family history. Her dad had a heart attack at just 47. All of a sudden, that vague worry becomes a very sharp, very specific fear. We're going to press pause on her story for now, but don't worry, we will come back to it. Okay, before we all get carried away by that story, we've got to hit the brakes and ground ourselves in the actual data. This is where we start to fight back against that anxiety with some cold, hard facts. I really want you to take a good, long look at this number. If you take away only one thing from this whole explainer, let it be this. In a staggering 98% of cases when a child has chest pain, the cause has absolutely nothing to do with the heart. And this chart just lays it all out, doesn't it? Look at that tiny, tiny sliver. That's the 2% that represents heart-related causes. The rest of it, that huge, overwhelming majority, that's, well, everything else. It's such a powerful visual because it instantly reframes the entire problem. It's not a likely catastrophe, it's a very, very unlikely one. So you're probably asking, okay, if it's almost never the heart, then what on earth is it? Great question. Let's start decoding the usual suspects. So when doctors can pinpoint a specific cause, the number one culprit is musculoskeletal. We're talking about the chest wall itself, the muscles, the bones, the cartilage. It could be something as simple as a pulled muscle from coughing too hard. Coming in second are psychogenic causes, and these are very real pains that can be linked to stress or anxiety. And then you've got respiratory stuff, like a nasty cough. Now let's dig into those muscle and bone issues, because this is super common. You've got costochondritis, which is just some inflammation where your ribs connect to your breastbone. And here's the key diagnostic trick. A doctor can actually reproduce the pain just by pressing on that one spot. Now compare that to precordial catch syndrome. That's that classic sharp, stabbing pain that literally makes a kid freeze. But here's the difference. You can poke and prod all you want, you can't make that pain happen again. And believe me, the list of totally not scary causes just keeps going. It could be plain old heartburn from acid reflux, it might be muscle strain from a really bad coughing spell or an asthma flare-up. Heck, it could even be a skin issue that's irritating the nerves in the chest, like shingles. The point is, the range of possibilities is huge. Okay, so we know it's probably not the heart. And that feels good, right? But probably isn't definitely. We can't just ignore that 2%. So to be truly empowered, you need to know what the real warning signs look like. This is when you stop being reassured and start getting concerned. So listen up. This is important. Chest pain by itself is one thing, but chest pain that brings friends to the party, that's a whole different story. If the pain comes along with fainting or a feeling of a racing or fluttering heart, that's a red flag. If it only shows up when your kid is exercising, big red flag. Seizures, trouble breathing, you get the idea. These things mean it's time for an immediate medical evaluation. And it's not just about what's happening right now. The alarm bells should also be ringing if there's a relevant medical history. Either the child has a known heart condition or certain other syndromes, or if there's a strong family history. Just like in our opening story, a close relative having a heart attack young, or a sudden unexplained cardiac death in the family, that's critical information a doctor needs to have. Okay, so you've seen a red flag, or maybe you're just too worried to wait. You decide to go to the doctor. Smart move. So what actually happens when you get there? Let's pull back the curtain on how they figure this out. It's not some big, scary mystery.
It's actually a pretty logical 3-step process. It all starts with a conversation, a really detailed history of the pain and everything about your child. Then comes a thorough physical exam. And here's the most reassuring part. For the vast majority of kids, the doctor can figure out what's going on with just those first 2 steps. No fancy, expensive, or scary tests needed. Think of the doctor as a detective, and the pain itself is their number one clue. They're going to ask really specific questions. Can you point with one finger to where it hurts? What makes it worse? Taking a deep breath? Lying down? What does it feel like? Is it sharp and stabby, or more of a deep, burning feeling? See, each answer helps them cross suspects off the list and zero in on the real culprit. All right, let's bring it all back home. We're going to circle all the way back to the beginning, to that 4-year-old girl with that very worrying family history, and see how her story actually ends. So, the first visit, nothing conclusive. But then 5 days go by. She comes back and the chest pain is still there. But now there's a new clue. She has a rash, an itchy, blistering rash right in the same spot where the pain is. And that changes everything. And the diagnosis, you ready for this? Shingles. It's a reactivation of the chickenpox virus that lies dormant in a nerve. And here's the incredible part. That intense, burning nerve pain can show up days before that telltale rash ever appears. So her pain had nothing to do with her heart or her muscles or her family history. It was her skin and nerves all along. And really, this quote from the source material just nails it. The big takeaway is that you should feel reassured that the cause is almost certainly something minor and not scary. But that reassurance isn't just wishful thinking. It comes from a calm, systematic process of making sure you've ruled out the serious stuff first. And that's what this is all about, isn't it? The goal isn't to pretend you'll never worry. That's just not how parenting works. The goal is to trade that paralyzing what-if fear for knowledge. Because knowing the difference between a simple chest wall pain and a genuine red flag, that's what lets you act calmly, confidently, and get your child the right help right when they need it.